Yeah, so we are going to discuss this topic. First of all, I would like to tell you that the formulation. I hope that your institutions might have discussed with you how to do the formulation and all. So my main aim is to discuss with you or to help you to understand an overall idea about how a biopsychosocial formulation can happen in a social work setting, and how to actually practically make a formulation and make a diagnosis. Next slide, please. Yeah, next slide. Here I'm giving you one case. It's like Mr. A, 26-year-old, educated up to pre-university course, is unmarried, middle socioeconomic status family, urban Bangalore. And he has presented with persecutory and referential delusion, and also second person auditory hallucination. And he is diagnosed with paranoid schizophrenia. And the duration of illness is 3 years. So if this is the case, let us see in the next slide, and what all the biological, psychological, and social factors involved in a case. So if you understand, maybe you might have maybe familiar with these terminologies like metabolic syndrome, extrapyramidal symptoms, cognitive impairment, social skill deficit, impaired socioeconomic occupational functioning, and family with poor understanding about the illness, and maybe expressed emotion from the family members, and stigma in family. So when we understand the biopsychosocial, and if you understand it in deeper section, deeper manner, it is an illness may cause multiple. It's like the biopsychosocial variables are maybe causing, triggering, precipitating in different manner. And same way, when the illness comes, it also will affect the biological, psychological, and social aspects. But so the understanding about the biopsychosocial variables are in a bidirectional ways. Next slide, please. And in this PowerPoint, I have mentioned a few other things, like maybe Dr. Soyuz, in the last session, he might have discussed with you about the psychosocial assessment. So few aspects of assessments also I have included, though it may not be that much useful at this point of time because he has already mentioned it. So you know that biopsychosocial model is proposed by George Engel in 1977. And all this fact, I'm not going to discuss in detail, but I'll be focusing more on the formulation part. Can you please go to next slide, Jobin? Yeah, that is why we have multidisciplinary team members here in our team. And next one. Yeah, so the formulation process. So how we are going to, as a social worker, how we are going to do the formulation. Let us see, next slide. So we know that in social casework process, we have all this intake, diagnosis, treatment, termination, follow-up. These are the process actually. It comes step by step. This is all the things are going on. Next slide. Yes, there are various approaches or various models in formulating a case in social work, especially when we do the casework. There are different models, but here let us there are many other models. I'm going to briefly discuss about the biopsychosocial perspective or biopsychosocial formulation of a case. Next slide, please. Yeah. Biopsychosocial assessment, we know that it's since 1917, Mary Richmond started talking about the social diagnosis, and Hollis have given a person and environment concepts. And generally, the typical psychosocial comes to a social worker. For a psychologist, it goes to psychological assessment. You know, you may be knowing all these aspects. I'm not going to discuss with you in detail all these things. Next one. Just I'm trying to orient. And when we say the psychosocial aspects, so we will be focusing on the familial, individual, And when we talk about the individual aspects, the biology also comes there. And family and social and cultural, legal and economic aspects all comes under an umbrella. Next one. And yes, we know that in NFPSW's helping process, it's all about the clinical evaluation, all the other assessments, and analyzing and formulating and diagnosing and interventions. So these are the helping process comes from our side. Next slide. Yes, I already discussed about individual aspects, familial aspects, and social areas. Next slide. So when we say analysis, maybe from this, we need to understand how the assessments, we assess or we will find out many factors. It's like the many data from the patient, from the family, from the social sphere, and maybe from the collateral contacts. We will be getting many details or facts. So what we are trying to do with this data is to understand the cause-effect relationship and providing a basis for problem solving and decision making. So this is why the analytical part, or from here the formulation, it's starting the formulation, though it's starting from the assessment, but here we are trying to use a typical theory, how the details are collected from the individual, family, and social aspects, how we trying to connect these things to understand what is going on with the client or clients, and how to help these clients. So questions are coming. So what is the problem and how to help them to address their problem? Here the analytical or analysis is starting. Next slide. And when we diagnose in social diagnose, or we'll say, actually I would like to call it a psychosocial diagnosis. It's not just a social diagnosis for a clinician or a person who works in mental health especially. So the social diagnosis should be very brief. It should be self-explanatory. I use a universal language as much as possible. And social diagnosis will give you an idea where you start working with the patient, or sorry, not the patient or the client, or the terminology that you're using in your clinical settings. So, and it's not just fit into the ICD-10 criteria, or Z criteria, or DSM-5. It is beyond the purview of this ICD-10. And when we were students, we were using mainly ICD-10, and actually now we are actually changing ICD-10 to 11. So we were depending on the Z criteria or category. Now it is not just in the purview of the ICD-10 Z criteria. It's more than that. It's more about social workers understanding perspective and the meaning making of a social worker and the client's problems and in the helping process. And if a professional social worker it's an interpretation of a person's problems in a scientific manner. So social diagnosis, it's not just maybe a one single word, a sentence, or even an explanation as well. So we cannot, unlikely a psychiatrist or a medical doctor or a medical or a clinical nurse, or maybe even as a clinical psychologist, we cannot just fit into a single statement or single lines diagnosis like, oh, this is schizophrenia or paranoid schizophrenia. So our diagnosis is more than a sentence. But as there is no very clear understanding, even I'll say that even globally, though we have a PIE model of social diagnosis or psychosocial diagnosis, we are not trained in that way. Okay, even in many universities, even in India, in other countries, we do not have a typical manual, though we have PIE manual, but we are not following. So there may be some differences the way I present the social diagnosis, and sometimes the way you are taught or you are oriented. I would like to actually, it's like whatever I have understood, whatever I was practicing, and whatever the science taught or social work sciences taught us. Next slide. Yeah, and social analysis and diagnosis is an ongoing process with the client's participants, purpose of which is to understand people in relation to the environment. It's basis for planning what needs to be done and to maintain, to improve or bring about changes in the person, environment, or both. So I would like to talk about the analysis and diagnosis part in this way. Next slide. Yeah, so for a formulation, yes, you all may be knowing that we need clinical interviews, validated assessment tools. I think tomorrow they'll be talking about the assessment tools. And also we can use family assessment, pro forma, and social environment assessments. All these things, from all these ways, we collect the data. So this data will help you how to fit this data to understand this problem, understand a person, understand a client. Client may be an individual and a family. Okay, so this will help us to connect these facts. Next slide. So also I would like to request you to look into, I already talked about the bidirectional mechanism or bidirectional dynamism of biopsychosocial variables. Next one, next slide. So I'm not going to detail because I think yesterday Dr. Sois might have discussed with you this individual aspects. Next slide. This is this list of individual aspects that maybe we need to include for a social worker to assess in mental health setting, and the family aspects. And next slide. And social factors, economic factors, legal factors, many are coming into that list. Next one. Yeah, so it's all about, I already told you how the individual, familial, social factors to an illness and as an impact, or in other areas, how these biosocial factors are working. Next one. Next one. Next one. Yeah. Now I would like to discuss this case with you. Maybe you may be able to understand the formulation when I discuss this case. Maybe I'll read out Sita, a female, a 24-year-old. She's married. She's 8th standard educated, and she's a homemaker from low socioeconomic status family of rural background of Bangalore, and pre-morbid personality seems to be well adjusted. Personal history of there is a marital discord, and presented with 2 months history of purposive sadness of mood, crying spells, suicidal thoughts, worthless and hopeless. So there is a clinical diagnosis. A psychiatrist or a medical doctor has diagnosed her with moderate depression. Next slide. So here the assessment comes, right? In the assessment, the social worker understood many things. I will just read out. Sita, who is a 24-year-old married lady, educated up to 8th standard, from a lower socioeconomic status family of rural background of Bangalore district. And physical examination. See, what we need to understand, if the case you are going to formulate in a biopsychosocial formulation, we need to understand some biological aspects. We, as social worker, yes, I understand that we unable to understand or assess the physical aspects, but some aspects we need to understand. At least we have to accept that there are biological factors leading to the illness, or biological factors are as an impact of the illness. So let us see here what the medical doctor has found out. She has thyroid dysfunction. Before the illness, she was able to cope up with the stressors in her life. That means already we discussed the pre-morbid personality was well adjusted. She was able to cope earlier. She got married to Mr. Ganesh 7 years back and has 2 children aged 5 and 3 at present. Husband is with alcohol abuse, and altercations with him on his alcohol abuse was quite often. He used to abuse her physically, sexually, emotionally, financially, and she suspects that extramarital relationship in him. She is perceiving and receiving poor social support from both family of origin. family of origin of both, means from her family of origin and husband's family of origin. Both family think it is a wife's duty to manage her husband's behavior. Apparently, she belongs to a community which believes that wife beating is husband's right. So this is the community as community perspective or community picture in this case. Next slide. Slowly. So what's happening? Slowly, she was seen with sadness of mood most of the time, crying, hopeless, and felt worthless. Few times she had thought of committing suicide, but when she thought about her children, she aborted her attempts. And she was seen not able to do household chores and not interacting with friends, relatives, and neighbors. Recently, her husband threatened that he is going to divorce her, which made her more sad and hopeless. Her friend took her to IMHANS. So this is a case came to IMHANS. All the names and other things are actually fake. And IMHANS for consultation, who is the only one support at reported. And she doesn't know there is a legal help is available for her problems. And she thinks that she and children may be abandoned by her husband soon, and she may not be helped by the both family of origin. Next slide, please. Yeah, so how we formulate this case? So when we formulate, we need to understand we are trying to connect the biological, social, psychological, and cultural aspects to understand the case and try to help this woman with depression, moderate depression. So when we read out let us see how these factors, I already talked to you in an analysis or formulation, how we connect the data. So in the assessments, we have collected data that her individual aspects we have collected. We have understood her husband having an alcohol dependence syndrome and extramarital relationship. And there are many things that I already discussed with you in the assessment part. So how we are trying to understand how we are actually formulating this case using a biopsychosocial formulation. So Sita, 24-year-old married lady, what is happening here? Not well educated, right? Because she was just 8th standard from a lower socioeconomic status family, rural background of Bangalore. This is her socioeconomic, brief socioeconomic status. What is happening here? Poor financial status has contributed in malnutrition, which might have caused in developing thyroid problems. You know that thyroid dysfunction, thyroid problems and malnutrition is deeply connected, right? So we are trying to analyze, understand, maybe her financial status might have contributed in malnutrition, and malnutrition might have caused the thyroid dysfunction. Then what is happening? Early marriage. So we understood that she got married. I think her son's age was 5, right? So maybe she got married at the age of 18. So preferably the age is 20 and above, right? As per the new science. So early marriage without adequate gap in child's birth, like 3-year-old and a 5-year-old, right? And having 2 children in young age. See, what we are trying to understand here? She's from a lower socioeconomic status family. Maybe malnutrition is there. That's why thyroid dysfunction. So biological aspects is there. So early marriage without adequate gap in childbirths, like only 2 years, having 2 children at a young age, because the burden of a mother to look after 2 children, and husband with alcohol dependence syndrome. And yes, there is domestic violence because there is alcohol dependence syndrome may be causing for domestic violence, and maybe we don't know because of extramarital relationship or alcohol dependence syndrome, there is domestic violence definitely. Are stressors where she couldn't cope up healthy, and poor support from family of origin, which may be due to a gender inequality present in the community. So we need to understand that she is facing husband is with alcohol dependence syndrome, and there is a domestic violence from his side. Also, he has some other relationship, and this is a serious major stressors for her, and she couldn't cope up healthy. And because of her, why we will see her, she was able to cope better before onset of the illness. But maybe because of the domestic violence, alcohol dependence syndrome, extramarital relationship, also in addition, she doesn't have adequate social support from family of origin, from both the families, like family of origin of husband, family of origin of Sita, right? And also there is a gender inequality present in the community. That is why the community actually believes that wife beating is husband's right. And as a wife, as a female, she is like entitled to undergo, or she's bound to undergo all these kinds of domestic violence and misbehavior from her husband. And also she's under threat of abandonment. That means as there is no adequate support from her family of origin and even from other sides, and also she feels that okay, she may be thrown out of her house, she doesn't have any place to go, and she won't be having any shelter. And also she doesn't have adequate knowledge about legal support available from the community. So if she knew that, okay, even husband is having alcohol dependence syndrome, domestic violence, she can go to a legal system or a police or some other legal system and can avail help and to fight against or to protect her rights. So she doesn't know. So if she doesn't know how she is going to actually get help, and also her coping, when the major stress came, she didn't have anybody to actually depend. So her coping actually deteriorated and she started coping unhealthy. Maybe also all these above factors might have caused developing depression in her and made her dysfunctional. So when we understand her condition, her biological problems is there, and psychological coping is actually not working well, and her community believes that wife beating is husband's right. There is no way to get help from their side, or nobody questioned the husband, whatever he does against her. And on the bow, husband is with alcohol dependence syndrome, domestic violence, extramarital relationship. When all this comes together, she was unable to cope up with all these factors and she didn't have adequate support. So slowly her coping became unhealthy and she started developing the depressive symptoms and made her kind of dysfunctional. Luckily, we had, or she had as a friend who helped her to take her to IMHANS for support. So when we, in this formulation, you might have understood the biological factor in her. When a doctor understood that the doctor might have sent her for a thyroid evaluation. So that revealed that she has thyroid dysfunction. So that's another issue. And also when we see that her all social background, community background, all these are not very supportive for her. And earlier she was able to coping well, but now because of not having adequate support, not knowing, because of her educational background or not knowing there is a legal system to support her, and her coping became actually not good, not healthy. Slowly she developed depression and slowly she also became dysfunctional. This is the way, and through this example, I'm just trying to tell you, you can use any model. We can use any various other theories. Even there are cases we have formulated using multiple theories of psychotherapy theories. Like if we can use an eclectic model using behavioral theories or learning theories and psychoanalytical perspective. You can mix it to understand a case and mix it to even to help a person. So there is no hard and fast rule in social work, especially to understand and formulate and to help clinically any client, even a patient, means individual or even a family. Next slide. So when you somebody asks you how you diagnose, because in social work, and actually maybe people will criticize it's a medical model of diagnostication. Yes, but for a clinician, it is easy for it is easy to work with. It's easy to actually start. I have seen social work students actually finding difficult to what to do, what is the work. Like it's not just psychoeducation, psychoeducation, psychoeducation. It's more, nothing more than that. Even if you ask some students to formulate or conceptualize a case, they feel very difficult. They don't know how to conceptualize a case. They don't know how to see a case. They don't know how to see in the sense how to help a patient in or a client. Maybe they are able to do some kind of fixed kind of work, like okay, you do family assessment. If you do family therapy, then maybe able to do family therapy using maybe eclectic model or based on a single theoretical model or school of family therapies. But in social work, how to understand in a broad spectrum and deeper ways. So that may be difficult. So when you ask me to diagnose this case, because a social worker actually should start working with some points in this patient, right? In this case. So what we are getting when we actually did this case, starting with inadequate coping strategies. This Sita has actually her coping strategy was not adequate or not working well. So the diagnosis for a social worker is inadequate social coping strategies in this client. Also, there is a marital discord and domestic violence is present. So here, when the statement comes like inadequate coping strategies, when for a clinician, for a clinical social worker, then the intervention is starting working with the client and enhancing her coping skills, or coping skill training can be given. And marital discord and domestic violence. Yes, as there is a diagnosis of domestic violence or intimate partner violence, what we need to do, we need to actually help the patient, the client, to get support, legal support, safety concerns are there. It's not just for her, because as we understand, there are two children also. So when an intimate partner violence or a domestic violence happens, it will affect the children as well. So we need to actually support the children also. And also you need to understand the inadequate social support. So there is only one friend who is ready to support her, and there is no family of origin from her side or husband's side to support her, or even from her locality. So what we need to work, we need to actually enhance her social support, maybe primary social support, secondary social support, even tertiary social support that we need to work. So this is when we make this diagnosis, then the intervention actually starting from the diagnosis. So it will help. Okay, if it is schizophrenia or if it is a psychosis for a doctor, okay, then he can start antipsychotic. Okay, if the diagnosis is depression, then the antidepressant can be started or prescribed by the doctor. Same way for a social worker, as there is inadequate social support, then the social worker can start enhance working in that perspective. Then let us see next one, threat of abandonment. So if she's abandoned, if she's thrown out of her house, where does she go? And with these two children, no. So maybe shelter, a shelter for women with women facing domestic violence, we need to find out. So an NGO or any government system that can support her should be identified, and the safety concerns are there. So she should be sent to the concerned supporting centers. Also, there is socio-occupational dysfunction. Maybe her socio-occupational dysfunction is started. So maybe starting working with her coping skill enhancement. Maybe here we can start her socio-occupation. She may not be able to do the household chores and all. Maybe we can start working on her behavioral activation, activities of daily living. All those things can be provided. So these are the things that the social worker can work with. And also, I already briefly discussed with you that need of protection from domestic violence, legal services, and shelter. So this very practical support that we can start providing her. Just 1 minute. Yeah. Next one, a community of gender violence is permissible. The thing is that community, it's very, maybe for a social worker, yeah, though social worker needs to work with it. Still, it is actually, we need to work on this. But for this a mass working strategy we need to develop. So community with gender violence is permissible. Difficult to work, I'm talking about, it may be difficult to work, but still a community social worker actually can work in this community, or in generally we can start working against the gender violence. And we know that gender violence and mental health is closely connected, right? And maybe difficult part for a clinical social worker, but for a community social worker, yes, we can start working. And even other methods of social work can be used to fight against this issues. Next slide. So when we try to analyze or formulate that, what we need to do, assess all the areas. If you actually miss some areas, your formulation and analysis may be difficult, or maybe missing major crunch of work with the client. So maybe we can try to analyze in terms of cause effect relationship, or maintaining factor, or impact factor. You can use in any way, but try to incorporate all the factors. And also what we need to actually look into, when you get a client, when you try to understand, means assess, when you try to formulate and diagnose, and what exactly, because it's a practice-based profession, or very practically helping profession, right? We need to actually pinpoint where we can work with this patient or client, or what exactly we can give from our side to the client, what exactly we can facilitate for this client. And so for a doctor, for a psychologist, it's more about the medicine or more about typical psychotherapy. But for social worker, we have enough freedom even to work with psychological interventions, psychological aspects, and other social services we can actually facilitate for the clients. So that is a freedom for a social worker, and the formulation may be slightly different from the clinical psychologist. Next slide. So maybe you can present it in any way. You can use, maybe for this may be helpful in your case presentations, need not be for a practitioner. When you are a practitioner, you may not need not to go for all these kind of things. Still you can do it, but not very generally people won't do in practice. But for a student, yes, when you do it, and you for submission of your case records and all, you can use the diagrammatic presentation, descriptive statements, mixed methods, and you can use it. Maybe something that I'm going to show next slides. Next slide, please. You can use various factors, how this is affecting one into other. So formulation can be presented in a pictorial ways. Next slide. Same way. So better, and even perspectives are different, like illness perspective or strength perspective. Even in any model, actually you can use it. But still, the methods of using any formulation or theory, this is a method of doing it. Next one. Yeah, I think it's over. And I would like to tell you once again that teaching you the assessment, formulation or analysis or diagnosis actually takes time, because we need a case by case. It is easy for a social work teacher to teach you how to do it exactly, very practically, because it needs a little more practice. That will help us. Otherwise, sometimes some people find it difficult. This is my experience. When I started teaching, I started learning this social work assessments, diagnosis, formulation, and all. Also, when I started teaching students, and students also found difficult in the beginning, but later, once they start exactly doing it, it's easy for them.